Here in this procedure room, Dr. Slonim kills fibroids. If you're not sure what a fibroid is, you're not alone. Even though 26 million women here in the country suffer with uterine fibroids, they don't always know their options. And Dr. Slonim wants to bring awareness.
And even though I'm injecting here at the wrist, the tip of the tube is down in the uterine artery, and that's where the particles are coming out. It's a good day to kill fibroids.
That wrist belongs to this woman. Her name is Kendra, and she's just about to target an issue that's been a source of pain for the last 8 years.
As they get bigger, they are worse. It almost feels like somebody hit you with a hammer in your stomach. That's the best way I can describe it.
She's talking about uterine fibroids, and she's not alone. Although not every case a painful one, approximately 80% of Black women will experience uterine fibroids by the age of 50. I'll let Dr. Suzanne Slonim explain.
Fibroids are the most common tumor in the uterus, and they are benign, which they're non-cancerous, and they're made of muscle cells and fibrous tissue. And they seem so simple when I say that, but they can really ruin a woman's life.
A common remedy is a hysterectomy, the surgery to remove the uterus. But for Kendra, that wasn't an option.
I'm still young. I'm not, I don't want to go into early menopause unnecessarily, right? So this is an alternative to allow me to keep my ovaries, keep my uterus and all my hormones that's associated with it so that I can, be normal. I don't want to take pills for the next, 10 or 11 years until I actually menopause.
1 in 3 of all hysterectomies in the U.S. are linked to fibroids. And Dr. Slonim is dedicated to bringing awareness to a minimally invasive procedure called uterine fibroid embolization, or UFE.
The surgical equivalent of this takes 6 to 8 weeks to recover from. And while I'm not making a big incision in the body, I am killing the fibroids. And women do need to remember that they've been through a big process and they can't go out and run a marathon this week. Maybe next week, but not this week.
Dr. Slonim's passion for giving women that knowledge was the spark that led Dallas City Council to join 2 U.S. cities and 9 states to declare July as Uterine Fibroids Awareness Month. I got to join her earlier in the week as she spoke at a live council meeting.
It's time for women to really take control of their bodies and their health care.
And for patients like Kendra, taking control of her health was a decision that took some time. She was scared to undergo any kind of procedure. But with Dr. Slonim's guidance, she felt this was the right time.
I suffered in silence. A lot of my friends have no idea that I've been living with this. I'll be out in the event and why I have to go to the restroom every 30 minutes to change a pad. They have no idea. They have no idea.
I've seen for decades women having to have a hysterectomy when they didn't really want to, or women who are so sorry that they did. Even if they don't want to have children anymore, women need to know what their options are.
Dr. Slonim says she's proud to see Dallas being a catalyst to conversations that lead to solutions.